She's a registered nurse on cardiopulmonary floor at Northern Westchester Hospital in New York. She has received bachelor's in science from New York University and master's of science from Columbia University, and is a doctoral candidate this year. She has been working as a nurse for 4 years and has worked in private nursing care and hospice care. Our icon today is a frontline nurse for COVID-19 for New York Presbyterian. It is my honor to welcome Janelle Berridge as our guest on Inspiring Icons Insight. First of all, Janelle, a deep gratitude for accepting our invitation to share your experiences and insights with our viewers and sparing time in this demanding period. Welcome, Janelle.
Thank you. Thank you for having me.
So we would love if you could share your experience of this pandemic, which has swept the whole world off, of your, as a frontline health professional, what were the challenges you faced?
Of course. This pandemic has been very difficult for all, but especially healthcare workers, where we've been challenged with taking a higher number of patients, a higher acuity of patients, a lot more demanding scheduling and work conditions. We've been challenged in every way that someone can be challenged, intellectually and physically and mentally. We have had to watch people walk into a hospital that very well might not walk out, that don't have their family support systems there with them, like in normal circumstances they would when going through such a traumatic experience and illness. So we've had to take that role. We've had to give that comfort. We've had to really just been faced with a disease unlike any other that can just evolve so rapidly. And we've been, risking our own lives, and the fact that, of course, things like masks and PPE have been on a shortage. And when you're in an emergency situation, you don't always have the time to put all of that gear on. Your priority is the patient and getting to that patient. So it's been a challenge, and it's added a lot of components to the job that we're not used to.
Sure. And, the overwhelming phone calls and the panic, and how did you deal with that? I mean, you were handling the hotline, so would you share that? Yeah.
Of course. I worked for a COVID-19 hotline with New York Presbyterian, where I helped answer calls that could be anything from a simple, what is COVID, to I have these symptoms, what should I do? One thing that was difficult about it is trying to be there for somebody emotionally and connect with them through a phone. It's a lot easier when you're in person and you can have emotions and such. So over the phone, that was a struggle for me. But essentially what I did was try to reassure people in a time that's very scary. It could be very simple symptoms, and it could be something just allergies, but because of what's going on, everybody is concerned that it's the worst case scenario. So I would have to answer phone calls and try and reassure people and give them advice on what to do. And in some situations, tell them that their best chance is to go straight to the emergency room to get medical help. But a lot of it was just explanation and education and reassurance, because this is such a scary time and people were really concerned.
And you personally took care of some critical patients as a nurse. So how was that experience? I mean, when especially not knowing if they will ever see their family again, how did you deal with those emotions?
Yes, that was difficult. This is not what we're used to. We're used to allowing family members and support systems to be there when we have patients that are so critically ill. And even some situations when I did some shifts in the ICU where these patients are trached or vented and under heavy medications to keep them sedated, and their family members are just so worried. What I would do mostly is try to be in contact with the family as frequently as possible through phone calls. And a lot of times I use my personal cell phone to FaceTime them so that they could see their loved ones and they could have last words with them, and they could make sure that they express to them that they are there, even if they can't be physically. Because now a role had changed with this. We had to take on this support system for our patients and almost this family role for our patients, because they couldn't have their wife or their mother or their children or their grandchildren at the bedside with them like they normally would have. And that took just as big a toll on those family members that couldn't be there for them. So I really tried to work with both ends, try to be there for the family and be there for the patient, and do what I could to unite them, even if that meant virtual contact through a video chat.
And how did that affect your personal life? I mean, what emotions, this was something completely out of the blue, even though as a nurse, you're a compassionate, empathetic person, those other qualities you develop, but this was a whole different level. So what did you go through, Janelle?
Right. That was very difficult emotionally. I mean, in this field, we see things that we see death a lot. That's not something that's new, but seeing it in this circumstance and seeing how rapidly it evolves, and the fact that they can't have their loved ones there, has been very difficult. And being the one to hold the phone while somebody says their last words to someone is not an easy thing to experience, and it definitely takes an emotional toll on us. And so dealing with that, I think that we, as the healthcare providers and the nurses on our floor, we kind of use each other as a support system, and lean on one another to get that relief. And otherwise, it's just been time to take moments on our days off to have self-care and to speak with our loved ones and make sure we have that time with the people that we love and care about in our life. Because dealing with something like that and having to witness people not having anyone there for them for their last days has been very difficult.
So how did this change your perspective or your mindset, this whole experience?
It's definitely shown me, the value in social contact and being able to have a lunch with your friends or go out to dinner with your parents on their birthday, the value that really has. And it's also allowed me to prioritize things, because as much as I love my friends and I love my family, I know the work I do and the exposures I have, and I would never want to put someone else at risk of getting something like this. So I had to prioritize in that way, and value the people I love high enough to not see them, which has been difficult.
And you could not meet your family, your parents, and because you were a frontline nurse, so that would have been a very difficult period for you.
Right.
You must have felt very torn between family and work, right?
Right, absolutely. And my family as well, it was very difficult for them, because at one point earlier this month rather, I myself came down with COVID because of my exposures to my patients, and that tore my parents, the fact that they couldn't be there for me when I was sick. Luckily, my symptoms were not anything that warranted hospitalization, but just simply being able to come over and give me Tylenol is what they would have wanted to do, or if it was just chicken soup, but that was not something that they could do, nor would I have allowed them to do, because I wouldn't want to expose them to something like that.
So going through this, crazy experience, what do you think you would like to share with our viewers as what is it that we should appreciate, accept, and adapt moving forward? Because these are going to be a different world altogether. So how can we use this experience to enhance and improve our life?
Right. I think we have to have a lot of focus on just the basic understanding of transmission of diseases and the importance of doing certain things when it's as simple as washing your hands and covering your mouth. I think there needs to be a good importance on that. I think we're going to have to adapt to a much more virtual world when it comes to, school, college classes or meetings being on a virtual video chat, even if it means, working from home more when you have symptoms of being sick. And I think we're going to have a lot more focus on mental health, because I think that's been a big thing that's been impacted with this. We talk a lot about COVID and the physical things that it does, but it has a big impact on people's mental health, even those who are not hospitalized and are just being affected by the quarantine in general and not being able to socialize. So I think that this is going to be a big turning point for mental health.
Yes, that's true. The stress and the uncertainty and the fear of survival and the cordoned off, being isolated. I think that is going to be in times ahead to come a very big challenge to deal with. Yes, so just be grateful and appreciate small things, like you said, even having a cup of coffee with a friend or sharing a meal and feeling grateful about that, but of course being mindful. So thank you so much, Janelle, for the time, for your insights. Are there any regrets at all you would like to share with our viewers, because our series is about insights and regrets? So.
No, if I had to say regrets that I had, I'd say not appreciating those things when I had them, not appreciating what it meant to sit in my classrooms at Columbia to get my lectures versus having to have them on a video chat, and not appreciating that time of relief after an exam when I got to go out with my friends and just have a drink or have some good food and laughs, and what that meant and the relief that that gave me. Because I think I did take it for granted now that it's been taken away, and I've had to adapt to this different world. So that's definitely a regret.
Thank you, Janelle. And we hope that we can all support the heroes that you all are in saving our lives, and we can do our bit to keep this world a much better place to live. Thank you.
Thank you.